Hello, everybody. John Marshall from the Georgetown University Lombardi Comprehensive Cancer Center's Rouge Center for the Cure of GI Cancers, and I'm joined by my good friend and amazing partner, Dr. Marcus Noel. And the two of us thought we would take a little time to do a deep dive on this young people with colon cancer problem that we are seeing, and of course brought to light by some recent news of out of the blue, that another young person getting colon cancer, this time a very famous one. Marcus, what happened?
So thanks, Dr. Marshall. Yeah, as we all are aware, the recent passing of Chadwick Boseman, which really came as a shock to many, given the fact that he is so young, but also able to work and succeed despite his diagnosis of colorectal cancer. So it was definitely disheartening for many of us, but important for us to be able to discuss colorectal cancer, which is certainly a major health problem across the world.
I mean, let's talk about him a little bit. I mean, he obviously made movies during all of this. He had to have gone through probably surgery. We're all speculating. Neither of us were his doctor that I know of. And, and had to probably undergo treatments, more recently probably chemotherapy and the like. And yet the world really didn't know that at all, which surprised me.
Yes, I mean, we both treat patients with this disease, and requires intense chemotherapy, likely surgery as well. And so oftentimes patients have to take time out from work, have various side effects from treatment, whether it be fatigue, nausea, etc. So it's remarkable that he was able to undergo cancer treatment and still perform at the highest level in producing these movies.
Absolutely. I mean, I'm old enough to remember, you're not, because you're still a young man, but I'm old enough to remember when nobody in our clinic, nobody in our clinic was under the age of 50. And now you look around and, some days it feels like half of our clinic is under the age of 50. And we're seeing 20-year-olds, 30-year-olds, 40-year-olds with the disease. Any thoughts as to what's going on there?
Yeah, there's definitely been a change over the last 20 years or so, where we're seeing an increase in the rise of colorectal cancer in patients under the age of 50. We don't exactly know what the reason is for this change, whether it's diet. Certainly the typical U.S. diet that's rich in fats and other meats and such. Maybe that's playing a role. We're not sure if it's something innate within the microbiome or the bacteria within the gut. Does that play a role? It's definitely puzzling, but it's on the rise, and it's a concern for all of us in the field.
Yeah, I mean, when I look back, I mean, the original story was, it's because we're all sitting around on our couches and not exercising. But, frankly, most of the patients that I see with this disease at a young age are like Chadwick Boseman. They're young, they're fit, they're conscious. He looked great, right? So he's clearly not sitting around playing video games all day long. And no family history. The original thought maybe this was, running in the genes somehow, but we haven't been able to track that either. And it is now clearly a global phenomenon. So we and others, as you mentioned, are trying to figure this out as quickly as we can so that we can, do a better job with screening. And I always like to come back to this point that, it was for a long time 50-year-olds should be screened, but it always was for Black people, African Americans, that it was supposed to be 45. And yet I don't think primary care docs, screening docs, insurance companies really embraced that. And so let's get your thoughts a little bit on the uptake of screening in the Black community. Certainly, what's the compliance with that 45-year-old screening, and is that enough?
Yeah, so I think you raise a really great point. I mean, the best thing we can do for this disease is to really catch it either before it develops or when it's a very early stage, and that can be done with screening. And it's well reported that screening rates of colorectal cancer are certainly not equal across the country for various reasons, whether it be socioeconomic status or access to healthcare, insurance, et cetera. But there is definitely decreased rates of screening in the African American community, in part due to our healthcare system, but also there is almost a perception, I believe, in the African American community that going through this testing, why I don't need this. It's invasive. It took me 5 years to convince my own mom to get a colonoscopy when she turned 50, and I've now, it's even difficult to get people to sign up for it. So I think that we need to continue our efforts to equal the playing field in African American communities, as well as really get rid of the myths of what is involved with colonoscopy, because it really does save lives, and it's so critical for everybody over the age of 45 now.
Well, and I also was thinking about, the process of getting screened. I've always compared our world to the breast cancer world. I mean, if you're going to get a mammogram, you can, I always joke, get squeezed in over lunch and go get your mammogram, but you can't do that with a colonoscopy. It takes a day before at least to prep. You have to get a ride in, you got to get a ride home, probably a day off work. And of course, not everybody has the luxury of a job or the support around them where they can just do all of those things. So clearly it is a screening mechanism or a screening system that does favor those who have better access, if you will, to it. So it's a real barrier that we've got to come around. I mean, there's a lot of Cologuard ads on now and other ways to screen for colon cancer. Do you think, what's your take on it? Are those decent replacements or substitutes for colonoscopy?
So certainly the gold standard is a colonoscopy, and that's really what we should shoot for. However, there are other testing mechanisms where you can sample the DNA in the stool, and based on that, can potentially catch some cases of colon cancer. So if a colonoscopy is not feasible for whatever reason, then a Cologuard or similar testing would be acceptable, in my opinion.
Yeah. Well, let's give the gang a bit of a uptake on, what are the warning signs. So a lot of our patients were just going in for their screening test and got discovered, but there are some warning signs to look out for. What are the top ones that you list for folks?
Absolutely. So the ones I think about that are most concerning are going to be a change in bowel habits. So if all of a sudden you are experiencing constipation or diarrhea, that's been a recent change that's persistent for several weeks, that's a concern. Certainly any kind of blood in your stool. It's abnormal to have blood in your stool. So if you do, you want to definitely let your physician know. Abdominal pain, weight loss in an adult patient, these are all warning signs for cancer. And particularly in young patients, you may have to advocate for yourself because initially, your physician may not pick up on potential risk for cancer. But if you do have any of these symptoms, you want to advocate for yourself, because these are potential warning signs for colorectal cancer.
Your point about young people is so good. The Colorectal Cancer Alliance did a survey and published it at last year's ASCO that looked at young people and essentially the delay in diagnosis of when their first symptoms occurred and when they got their diagnosis. And I think it was 2 or 3 times longer that if somebody my age went in with blood in my stool and change in bowel habits, I'd get a colonoscopy in a week. Whereas if somebody your age went in with the same symptoms, they might wave it off and say, well, if it keeps coming, we'll get you one then. But so as you say, I can't reiterate that enough to everybody. You got to advocate for yourself to get these tests and really be pushy about it. We're doing our best, you and I and our team, to try and inform our healthcare partners, emergency room doctors, primary care doctors, that it can happen in people under the age of 50. And so you have to respect those symptoms. Maybe just a quick close on sort of if you do get colon cancer and the impact on family. And it takes us back to Chadwick Boseman and his ability to really go unnoticed by a very public world that he lives in and manage this. But you and I take care of patients day in and day out where they really are struggling or maybe the patient is also the one who's got the insurance and they've got kids at home who are now doing Zoom school at home. So
Right.
it's different when you're 40 years old and have colon cancer than when you're 65 or 70.
Yes, it takes such a toll on not only the patient but their family. So for their spouse, oftentimes their spouse is right by their side at each visit, and going through that journey with them. But I've seen time and time again the toll it takes on the spouse that's involved with loved one with this disease. Many patients in their 40s, 50s have young children, and so imagine having to disclose a diagnosis to your children, or potentially with the side effects of chemotherapy, your physical appearance may change, and you have to explain that to your children. So it's just so difficult to watch these families struggle through this diagnosis, and something that's a bit different than someone who's in their 60s or 70s, where they're a different place in life and don't have the same stresses that a young patient would.
Yeah. So to everybody out there, Dr. Noel and I would like you to put us out of work. Get your screening. Stay out of our office. We're nice enough people, but we would rather not meet you that way. Get your screening, observe your symptoms, and do whatever you can to stay out of our office. On behalf of Dr. Marcus Noel, John Marshall for the Otto J. Rouge Center for the Cure of GI Cancers at Georgetown University's Lombardi Comprehensive Cancer Center.
Thank you.